One.
Hello, my name is Bridget Washington. It's March 3rd, and I'll be performing a wet to dry dressing change on our patient here. So I will first start off by washing my hands. And after washing my hands, I will put on a clean pair of gloves. So then I'm going to remove the wound here, the covering of the wound, working my way from the outside in, careful not to tear any skin from our patient. And I'm going to pull any packing out, careful not to tear any skin out. And after pulling out the packing, I will assess my wound for any kind of drainage type, color, and odor. Now I'm going to throw this in a biohazard bag. Wash my hands again. After washing my hands, I will now set up my sterile field. I will pull this back, careful to pull it back towards me, and grab my sterile field in the places indicated, only touching the blue side of the sterile field. And opening it away from me. And when I touch it, I can touch the 1 inches on the outside because that side is generalized as contaminated. Then I will take the contents of my sterile field and drop them on top, only 6 inches above. Throw this away. I will now set up my containers for my saline solution as well. Now put on my clean gloves to prepare to clean the wound. Take some gauze from one of the saline solution bags, wring it out, but fluff it a little, and clean the wound from the inside out, making sure to go under where there is tunneling to make sure that everything gets out of the wound. Wring it and fluff it a little from the inside out. Wring and fluff. And now I will drop this in the biohazard bag as well. Wash my hands. Take my applicators. Drop them into my sterile field. Throw this away. And now I will put on my sterile gloves. Being careful to only touch the outside that is contaminated, not touching the inside of the sterile gloves. Pulling this towards me, pulling that away from me, and touching only the 1 inches that are provided, not touching the inside of the sterile field. Now I'm going to take my non-dominant hand and grab only the outside of the cuff and place it on my dominant hand. And now I'll take my 4 fingers of my dominant hand using the hitchhiker's thumb to go under the cuff to place onto my non-dominant hand. Wriggling in. And now I'm sterile. So now I can take one of my applicators and a piece of gauze, wring it out a little that is soaked in saline, fluff it, and place inside the wound, making sure not to pack too tightly but to go in where there is tunneling. Ring and fluff. Making sure to cover the wound completely. Now throw this away. Now take the covering for the wound, place it over the wound. Covering completely, taking the tape, and now I place the tape over the covering in a window pan like pattern. Making sure that it is firmly pressed down but not too tight to make the patient uncomfortable. And since this is on the coccyx, I will tear the tape a little to make it comfortable for the patient in between the crevice of the coccyx. And now I will document what just happened. Thank you.